We want to take you to Toronto now, where Mayor John Tory is speaking as he tours a mass vaccination site in the city's East End.
In our vaccine rollout with the opening of our first 3 clinics. More than 453,932 doses have been administered in Toronto so far, and that's by the city clinics, but also by our hospital partners, by healthcare teams, and in pharmacies. 3 of our city-run mega-site clinics are open this weekend, and 29 other clinics, or in total there are 29 clinics open across the city over the course of the weekend to get people vaccinated. And now we're ready to open the doors to the Malvern Clinic here in Scarborough and to the Mitchell Field Arena in North York starting Monday. So those clinics at Malvern, here in Malvern in Scarborough, and at Mitchell Field in North York will open on Monday. These city-run clinics will be able to vaccinate 6,300 people a day and 44,100 people over the course of a week. It's great to see that this site is actually going to be opening on Monday to start getting shots in arms. In fact, it's been ready to open for some time, but there was a concern about supply of vaccine, which of course you need to have. That issue is now resolved for the immediate future, and we can open the doors of the Malvern Clinic and of the Mitchell Field Clinic on Monday. I continue to urge people to get registered and to get vaccinated. We have the clinics. We have 6, I believe I'm right in saying, the chief will nod or shake his head if I'm wrong, 6, including the Thorncliffe Park partner clinic that the East End Health Partners have put together as of Monday. We have the vaccines, we have the staff in place to do it, and we have the appointments. So all we need now is you. All we need now is you. And it's very, very important for people across the City of Toronto to get vaccinated. As of now, anyone 70 or older is eligible to get vaccinated in these clinics. Please get vaccinated. The registration for the same is simple and easy. Go to toronto.ca/COVID-19 and click on the big blue button at the top of the page that says Book a Vaccine. There's a big blue button there at toronto.ca/COVID-19 that says Book a Vaccine. Or if you're not as comfortable with the email or with the internet, you can go to the provincial call centre at 1-888-999-6488. But we ask you today to consider going to the registration system online or going to the phone centre and booking an appointment. I strongly encourage people who know they're eligible, and anybody born in 1951 or earlier is eligible. There are a few more who are eligible for the pharmacy program, but for this program, if you're born in 1951 or earlier, you are eligible, and there are clinics, there is vaccine, there are appointments, so we just need you. And if you're someone who knows someone of that age and you think it might be a bit helpful to help them register or to help give them a ride to the clinic, please think about making that offer as well, because we need to get people vaccinated. We have a number of programs through the city which you can contact your city councillor about or otherwise that help people get to the vaccination sites, but those are different programs. The first thing we need people to do is to register. I want to help our clinics out in terms of just reminding you of some of the things that will help us to make it even smoother than it already has been, and it's been very smooth. Please arrive as close to the time of your appointment as possible to avoid waiting and standing. Please do not come, and look, I'm a bit this way myself. I like to show up early just to sort of check everything out and make sure it's that I'm in the right place and all that sort of thing, but when people come an hour or two early, you might understand that it actually can complicate the operation of the clinic because we have people coming on very precise appointments. You'll see when you go to register that you get a very precise appointment, and we can tell you that when you come for your appointment, you will be dealt with in a way that is quite smooth and on time and doesn't take an undue period of time, but it helps us if people come close to the time of their appointments and not an hour or two early. If you have an appointment booked, your vaccine will be here and the people to administer waiting for you at that time, and you will be looked after. There is no need to come early. All of our sites are accessible and have designated accessibility entrances, and there are numerous staff and first responders on site to help those who might need a little bit of extra support. Please look up the information on the specific clinic you're visiting once you've made your appointment, before your appointment, so that you can use the best entrance to suit your own needs and so that you can be a bit more familiar with the places you're coming to if you're not familiar with them. But we've tried to locate these in places across the city so that none of them will be too far away for people who are going to those clinics. May I say thank you to our city staff and to our healthcare partners who are working on this vaccination effort. This is and will be the largest vaccination effort in the history of the city, and it's going to be successful. It's going to be successful because we're off to a great start with the clinics that Chief Pegg and a whole team of people have put together, and with the staff who have been trained to do this in a way that is sensitive and efficient, and with everything else. We've had a few issues we've had to wait on with regard to supply, but we're now in a position where we have lots of appointments available, even appointments available for this coming week, so that if you go to toronto.ca/COVID-19 or go to the call center, again, I think I've got that number right in my head. I don't even have to look down at the paper now, 1-888-999-6488. If you go there, and I think you can see it right in front of me, people will be there to accept your call or to accept your registration online right now, so that you can do it right now. We need you to sign up, not to put it off, quite frankly, because we all put things off for a variety of reasons. And the reason it's so important that we need you not to put it off is because with the numbers that you see that are going to be of some concern to all of us, obviously, there are still numbers that are very troublesome for us and represent a big challenge for us. We have two essential weapons that we can use in dealing with those numbers. And those numbers involve human beings that are becoming infected with the virus. And of course, pardon me, in so doing, posing a risk to their families and to their friends and so on just by having the virus. We have two weapons to fight that. Weapon number one is the same one that it has always been, which is distance and accompanying distance and keeping your distance from other people other than those you live with. It is wearing a mask, washing your hands, and things like that that I think you're very familiar with by now. But weapon number two, and it is just as important, is vaccination. Because the faster we can get more people vaccinated, the more protection that will provide to more people in our city. And so that is why it is important to act now and not to put this off, as we often do with many, many things. Distance and vaccination are the two most powerful and effective tools that we have. And you know, the vaccination and the existence of vaccines so soon after this virus was discovered, just over a year ago, is actually a miracle. The fact that we have supply of it now is something that is, I think, a source of hope. The fact we've been able to get these clinics set up and have them professionally and properly staffed and with appointments, thousands of appointments ready for you to take advantage of. So now all we need is people to come and get vaccinated, and that will be one of the two most powerful things you can continue to do. One, continue to keep your distance, wash your hands, not socialize with people you don't live with, and two, get vaccinated. So we need people to get vaccinated. We have clinics with more opening on Monday, and we need residents who are eligible to sign up as soon as possible. We have tried to make it as easy as possible, and by every account that it is. Kaylee, who was here, one of our wonderful staff members from Toronto Public Health, says people are grateful when they have received their vaccination. And that's my experience. When I talk to people, they're grateful, and it provides a degree of relief that you know that while you can't go back to normal behavior, you at least know you've begun the process of getting protection for your body that's accorded by these vaccines. If you now want to ask this question, what can I do to help? A lot of people ask me that question. They write me emails and they say, what can I do to help? Well, the answer to the question of what you can do to help principally now is to keep your distance and to take 2 periods of time, maybe 3 periods of time out of your life. One, the brief period of time it will take you to register online or by phone. The second is to show up to get your first injection, which you can do within a matter of days because of the registration system and the appointments we'll have at clinics like this that open on Monday. And the third is to then show up and get your second vaccination in a few weeks' time, and in between to continue to follow public health advice. So I thank you in advance for doing that. I will remind you one more time of the fact that the way you can do this, and you can do it now, today, and all through the day, is to go to toronto.ca/COVID-19 or to go to the telephone call center operated by the province, 1-888-999-6488. I will feel really good today in terms of our battle that we have. All of us together, a whole team of thousands upon thousands, millions of people trying to wrestle this virus to the ground. I'll feel really good today if we see you respond by going to the phone or going online and registering, because that's how we know people have made the appointments to keep these clinics busy, and more importantly, to keep to get people safe and keep them safe by getting vaccinated and keeping distance. So we're now here to answer your questions if you have any, and I don't know if my friend from CP24 has any. Well, and if there aren't any, then I will just say thank you very much for your anticipated cooperation. This is a fight we all have to engage in together. This is a fight that we have to win, and we will win. It is springtime, and that's a time of hope and renewal, and the best chance we have at renewing our lives to what they were before is to get vaccinated and to follow the public health rules during what continues to be a very challenging time for all of us. So I thank you in advance for your anticipated cooperation. I'm very happy at the fact that thousands of people have taken advantage of the opportunity prompted by a change in the age to people born in 1951 or 70 years of age or older, and I think there have been thousands who've responded to that. But here's the bottom line. There are still many, many people out there of all ages from 70 up who have not yet chosen to make an appointment to get vaccinated. And we can tell you that we put capacity in place. We got the supply, albeit that it took a little while. We got the supply in place. We got the staff trained so that at places like this, we're capable of taking thousands of people every single day starting on Monday, and some of the clinics have been open for some time now. And so I guess I can't really be satisfied, nor can Chief Pegg or Dr. Davila or Councillor Cressy or Councillor McKelvey until every appointment is booked. So I will say I'm not satisfied, and that doesn't mean I'm critical or angry with anybody. It just means I'm asking people to take advantage of the opportunity to get vaccinated now, and we'll be satisfied when we have a sold-out situation.